Hi, my name is Kate Safran, and this is my final exam video. This is my boyfriend Brandon. He was kind enough to participate in this video. As we go through the exam, we're going to do some things that are kind of pretend, and everything I'm going to do is on one side, but of course in a real physical exam I would be doing everything bilaterally. So let's begin. First we would do the Snellen chart, which is the eye exam. And I would ask my patient, do you wear glasses?
No.
Okay. The Snellen chart would be up on the wall, and I would ask the patient to tell me which line they could comfortably read with both eyes. Then I would have the patient cover one eye and read what line they could comfortably see, and then cover the other eye and read what line they could comfortably see, and that would determine what their vision was. I would also then ask them, I would point to the green line and see if they could distinguish the green color, and then I would do the same thing with the red line to see if they could see the red color, and then I would also ask them which line was longer, and that would test for color blindness. Okay, next step, we would go on to blood pressure. Do you know what your blood pressure normally runs?
No.
No. Okay. First, we would take the blood pressure cuff and apply it to the arm. Okay, and then you can rest the arm down on your leg. Would you hold that for me? Thank you. Okay. All right. I would apply the cuff, and then I would feel for the brachial pulse and pump until I cannot feel the pulse anymore. All right, I'm at 120 and I can no longer feel it, so I'm going to pump it up to about 160 and hold it there. And I got 130/70. Okay. All right. After blood pressure, we would go on to skin. All right. So first, I would just inspect the skin. It is warm to the touch. It is a light pink color. It's soft. Hair is evenly distributed throughout. Turgor, there's no tenting, and instant recoil. Next, we're going to look at the hair. The hair is brown in color. It is soft and shiny. It's evenly distributed. I'm going to look at the scalp. The scalp is clear. I do not see any lesions. I'm going to palpate the scalp. It's intact. Do you feel any tenderness?
No.
No. Okay. Then we're going to look at the face. Can you turn towards me? All right. I'm looking at the face. It is symmetrical. Okay. Looking at the face is symmetrical. Palpebral fissures are symmetrical. Can you smile? The nasolabial folds are symmetrical. And then we're going to test the jaw. Can I have you want to feel for the temporal mandibular? Can you clench your teeth? Okay, and release. And then clench your teeth from side to side. All right, protrude the jaw out, retract in. Okay, so there is +5 strength in the temporal and maxillar muscles, and there was full range of motion of the jaw and +5 strength with a little popping and clicking. Okay, next we'll go on to the eyes. Looking at the eyes, the position is equal, and we're going to test for nerves 7 and 12. So can you squeeze your eyes shut and don't let me open. Okay. And then raise your eyebrows up. And then smile. And puff your cheeks out. Okay, so we can see that cranial nerves 7 and 12 are intact. Next, we're going to look at the corneas using my light. Corneas are clear. Irises are brown, round, and circular. Pupils are dark and round. Conjunctiva is pink. The sclera is white. If I had gloves, I would gently palpate the lacrimal duct, and they should be non-tender with no regurgitation of fluid. And then I also want to see if the pupils react to light. And they do. So pupils are round, react to light both directly and consensually. Next, we're going to do a test for accommodation. So I'm going to have you look into the distance and follow my finger to your nose. Okay, so pupils have accommodation, which tests cranial nerve number 3. Next, we're going to test visual fields, which is cranial nerve number 2, by using confrontation. So I'm going to have you cover one eye and tell me when you can see my wiggling fingers.
Yes. 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 Yes.
Okay, and I saw the same. Okay, and I would do that bilaterally. Next, we're going to test eye movement. So keeping the head still, following my finger, which is the cardinal fields of gaze test. Okay, and there was no nystagmus. I saw parallel tracking with the eyes. Okay, so next we're going to go on to the mouth. I'm going to inspect the lips. The skin is intact. They are pink. Lips are symmetrical. I'm then going to look into the mouth. Looking at the buccal mucosa, it is pink and moist. Looking at the teeth and the gums, teeth are straight and white. The gums adhere nicely. I do not see any retraction. I do not appear to see any lesions or caries. The uvula is midline. The tongue is midline. I do not see any lesions, and the tongue moves freely. See the tonsils. Tonsils are symmetrical, pink. I do not see any swelling. Do you have any tenderness in the back of your throat?
No.
Okay. If I had gloves, I would apply gloves and take a 4x4 gauze. I would gently palpate the tongue and the inner buccal mucosa for any lesions. Okay. Next, we're going to look at the ears. I'm first going to start with the outer anatomy of the ears. I'm going to gently palpate the auricle of the ear and down to the lobe. Okay. Did you have any tenderness?
No.
Okay. I'm also going to draw an imaginary line from the outer canthus of the eye to the top of the auricle, and they are in position. Next, I'm going to look inside the ear. I'm going to gently pull up on the auricle and back. And looking inside the ear, I can see the ear canal is pink. There's fine villous hairs. I can see the temporal membrane and the bones. And there is a cone of light. Okay. Now we're going to do the whisper test. So I'm going to have you cover one ear. I'm going to whisper 3 words and tell me if you can hear them.
Stars, moon, sky.
Yes. Okay. All right. Now we're going to use the the 512 tuning fork to do the Weber and Rhine test. Okay, looking at the face is symmetrical. Palpebral fissures are symmetrical. Can you smile? The nasal labial folds are symmetrical. And then we're going to test the jaw. Can I have you want to feel for the temporal mandibular? Can you clench your teeth? Okay, and release. And then clench your teeth from side to side. All right, protrude the jaw out, retract in. Okay, so there was +5 strength in the temporal and maxillar muscles, and there was full range of motion of the jaw and +5 strength with a little popping and clicking. Okay, next we'll go on to the eyes. Looking at the eyes, the position is equal, and we're going to test for nerves 7 and 12. So can you squeeze your eyes shut and don't let me open? Okay. And then raise your eyebrows up, and then smile, and puff your cheeks out. Okay, so we can see that cranial nerves 7 and 12 are intact. Next, we're going to look at the corneas using my light. Corneas are clear. Irises are brown, round, and circular. Pupils are dark and round. Conjunctiva is pink. The sclera is white. If I had gloves, I would gently palpate the lacrimal duct, and they should be non-tender with no regurgitation of fluid. And then I also want to see if the pupils react to light. And they do. So pupils are round, react to light both directly and concentrally. Next, we're going to do a test for accommodation. So I'm going to have you look into the distance and follow my finger to your nose. Okay, so pupils have accommodation, which tests cranial nerve number 3. Next, we're going to test visual fields, which is cranial nerve number 2, by using confrontation. So I'm going to have you cover one eye and tell me when you can see my wiggling fingers.
Yes. 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 Yes.
Okay, and I saw the same. Okay, and I would do that bilaterally. Next, we're going to test eye movement. So keeping the head still, following my finger, which is the cardinal fields of gaze test. Okay, and there was no nystagmus. I saw parallel tracking with the eyes. Okay, so next we're going to go on to the mouth. I'm going to inspect the lips. The skin is intact. They are pink. Lips are symmetrical. I'm then going to look into the mouth. Looking at the buccal mucosa, it is pink and moist. Looking at the teeth and the gums, teeth are straight and white. The gums adhere nicely. I do not see any retraction. I do not appear to see any lesions or caries. The uvula is midline. The tongue is midline. I do not see any lesions, and the tongue moves freely. Let's see the tonsils. Tonsils are symmetrical, pink. I do not see any swelling. Do you have any tenderness in the back of your throat?
No.
Okay. If I had gloves, I would apply gloves and take a 4x4 gauze. I would gently palpate the tongue and the inner buccal mucosa for any lesions. Okay. Next, we're going to look at the ears. I'm first going to start with the outer anatomy of the ears. I'm going to gently palpate the auricle of the ear and down to the lobe. Okay. Did you have any tenderness?
No.
Okay. I'm also going to draw an imaginary line from the outer canthus of the eye to the top of the auricle, and they are in position. Next, I'm going to look inside the ear. I'm going to gently pull up on the auricle and back. And looking inside the ear, I can see the ear canal is pink. There's fine villous hairs. I can see the temporal membrane and the bones. And there is a cone of light. Okay. Now we're going to do the whisper test. So I'm going to have you cover one ear. I'm going to whisper 3 words and tell me if you can hear them.
Stars, moon, sky.
Yes. Okay. All right. Now we're going to use the 512 tuning fork to do the Weber and Rhine test. So I'm going to initiate the tuning fork and place it on the top of the head and tell me if you can hear it better in one ear or equal in both ears.
Equal in both ears.
Okay. All right. And then next we're going to do the Rhine test. So I'm going to initiate the tuning fork and place it on the To do the Rhine test, I'm going to initiate the tuning fork and place it on the mastoid process behind the ear. Tell me when you can no longer hear it.
No.
Tell me when you can no longer hear it.
No.
Okay. So it was approximately 2 to 1. So that means that air conduction is greater than bone conduction, which is a normal finding of 2 to 1. All right. Next, we will go on to the nose. So first, we're going to inspect the outside of the nose. We're looking for symmetry. The nose is symmetrical. I'm going to gently palpate for any tenderness. Do you have any tenderness?
No tenderness.
Okay. Then we're going to look inside. Can you look up? I see fine villous hairs. The mucosa inside is pink. I do not see any lesions. And there is no discharge. Okay. Then we're going to palpate the sinus. I'm going to palpate the frontal sinus for any tenderness. Do you have any tenderness?
No.
No. Then I'm going to do the maxillary sinus. Do you have any tenderness?
No.
No. Okay. Then we can move on to the head and the neck. I'm going to look at the neck for symmetry. I'm going to palpate the sternocleidomastoid. I'm also going to palpate the trachea. It is midline. I do not feel any deviation of the trachea. And then we're going to palpate the nodes for any tenderness, and they should be non-palpable, which is a normal finding. Okay, so I'm going to test, then this would be bilaterally. I'm going to test the preauricular nodes, the post-auricular nodes, the tonsillary nodes, the submandibular node, and the submental node. And did you have any tenderness when I was palpating any of those?
No.
Okay. Then we move to the back of the head, where I'm going to test the occipital nodes by palpation. Do you have any tenderness?
No.
Then I'm going to do the anterior superficial clavicle node. I'm going to have you turn your head to the side. Okay, and then turn towards me. Okay. And tuck your chin down. All right. And then I can feel the suprascapular nodes. Okay. And the post-superficial clavicle. And then I'm going to do the infrascapular node. And I do not feel any nodes at all. They are all non-palpable. Did you have any tenderness?
No.
No, okay. All right, next I'm gonna check the thyroid. So I'm gonna have you swallow. Okay. The thyroid moves freely. Can you tilt your head from side to side? Okay. I'm feeling for the edge of the thyroid. Did you have any tenderness?
No.
Okay. So the thyroid was non-tender, not enlarged, and I did not feel any nodes. Next, I'm going to check range of motion of the head and neck. So can you put your chin to your chest, and then back, and then side to side, and then a lateral bend to your ear, and then to the other ear. Okay, and then I'm going to have you push your shoulders up. Okay. And then press against my hand. Press against my hand. Press against my hand. Okay. And same with the neck. Press against my hand. Press against my hand. Press against my hand. And then gently press against my hand. Okay. All right, so there was full range of motion and +5 strength. I am then going to palpate the temporal and the carotid arteries. So I'm going to palpate the temporal. Okay, and I feel a +2 pulse. And I'm going to palpate the carotid. And I feel a +2 pulse. I'm then going to auscultate both of those with the bell of my stethoscope for any bruits. And I did not hear any bruits. Next, we're going to check the respiratory system. All right. Everything we do with the respiratory system, we would also listen for on the anterior side, but just for time, we're just going to do posterior chest. So the patient is sitting upright independently. I'm going to feel the back for symmetry and muscle development. There's nice muscle development. It is symmetrical. I'm then going to palpate for any tenderness. Do you feel any tenderness?
No.
No. Okay. All right. I'm going to place my hands around the thorax, around the 10th rib. I'm going to have you take a deep breath in and out. Okay. And my hands kind of went like this, which means there was good expansion. All right. Now we're going to do test for vibrations. So using the palm area of my hand, I'm going to place it on my patient's back and have them repeat 99 as I move throughout the posterior back. All right, ready? So every time you feel my hand, say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. And what I felt was a lot of vibrations. There were more vibrations in the apices of the lungs, and they decreased in vibrations to the bases. All right. Next, we're going to test for resonance. So I'm going to have you give yourself a bear hug. Okay. And I'm going to percuss the back. Okay. And what I heard was resonance throughout. Okay. Next, we're going to test diaphragmatic excursion. So I'm going to have you take a deep breath in and hold. Okay. And right there, I'm going to place a tape mark and let out. Okay. And then, the first tape mark would be full exhalation. And then I'm going to have you take a deep breath in and hold it. Okay, and right about there. And that's my second tape mark, which is full inhalation. You can breathe out. All right, and then I'm going to measure that. And it is approximately 5 centimeters. Okay. Next, I'm going to listen to lung sounds. I'm going to use the diaphragm of my stethoscope and have the patient breathe through their mouth. Okay, take a deep breath. In and out. Lungs were clear. I heard no adventitious sounds. And you would want to make sure you get both the top and the bases of the lungs in each lobe. All right, and next we were going to test for CVA tenderness, which is the kidneys, and this position is the best way to test that. So I'm going to feel where the kidneys are. It's around sort of the last ribs. I'm going to place my hand and I'm going to do a gentle percussion. Tell me if you feel any tenderness.
No.
Okay. So the kidneys were non-tender. Okay. If I had a female patient, this might be an appropriate time to do a breast exam. I would first ask her if she does a monthly self-exam and help her walk through it so she can do it on her own, do patient teaching, and then go through a more in-depth physical exam myself. The appropriate time would be 1 week after menstruation. First, you would have your patient stand facing a mirror and inspect the breast for symmetry, look at the venous pattern, look for skin breakdown, nipple position. And then the next position would be hands on the hips, which can bring out any dimpling or puckering of the tissue. Hands on head would be the same, any dimpling or puckering. And then the next position would be laying down with one arm up. You can place a pillow for comfort for your patient. You want to use your 3 finger pads and do an even circular motion around the breast to gently palpate for any nodes or masses. You would want to palpate all the way around in an even pattern on both sides and palpate up to the tail of Spence in the axilla area. You would also want to check the nipple for any retraction or rash and gently palpate in directions for any discharge. From this position, you can also palpate the axillary nodes. So what I would do is have my patient's arm up a little bit, and we would want to palpate underneath the axilla for the central nodes, the lateral nodes, the pectoral nodes, the subscapular nodes, and then into the chest would be the internal mammary nodes. Okay, so next you would want to have your patient lay down on the exam table about 30 to 40 degrees head elevation. We would have a trigeminal light here that we would want to inspect the chest. We want to look at, first we're going to start with the heart. So I'm going to be looking at the jugular veins for any distension. And there's no distension. I'm going to check the brachial and the radial pulses. They are +2. I'm going to inspect the anterior chest for any heaves, which I do not see, and I'm going to palpate for the apical pulse, which I feel right here in the mitral area. The apical pulse should be able to be felt the best at the 5th intercostal space and the mid-clavicular line, where that point intercepts. Okay. Next, we are going to palpate the aortic area, the pulmonic area, Ebb's point, the tricuspid area, and then again the mitral area. With the diaphragm of our stethoscope, we are going to listen to all of those points for the heart sounds. We want to listen for the S1 and the S2. So starting at the aortic area, and the pulmonic, Erb's point, the tricuspid area, and the mitral area. Okay, and what I heard was in the aortic and the pulmonic areas, the S1 is louder than the S2 sound. In the Ebb's point, they're equal, and in the tricuspid and the mitral area, the S2 is louder than the S1. So then with the bell of your stethoscope, you would want to listen for any murmurs. So you would go over those 5 points again. Aortic, pulmonic, Erb's, tricuspid, and the mitral area. And I did not hear any murmurs. To hear if there are murmurs better at the tricuspid and the mitral area, you could have your patient turn to the left side, and that position might bring out those murmurs more clearly. For the aortic and the pulmonic areas, to assess for murmurs, you can have your patient sit and lean forward slightly. But we did not hear any murmurs. Next, you would want to assess the abdomen. So have your patient bend their knees slightly. Okay. You would want to have them empty their bladder beforehand. And you want to inspect the abdomen for any pulsations. You also want to look for peristaltic waves. And I do not see any. You would have your light here to get a really good visual. So there's no peristalsis waves. I do not see any pulsations. The abdomen is flat. There are no scars. The umbilicus is intact. I would then, with my stethoscope, with the diaphragm, listen for bowel sounds. and listen in all 4 quadrants. And I hear vowel sounds in all 4 quadrants. Next, you would want to check for pulses, and you would want to check the iliac and the femoral pulse, the renal pulse, and the aortic pulse for bruits using the bell of your stethoscope. Then we can move on after auscultation to palpation. You want to gently palpate the abdomen for signs of any tenderness or guarding. Do you have any tenderness?
No.
Okay. Then with 2 hands, you can palpate a little deeper for any masses. And I do not feel any masses. To palpate the liver, you want to have both hands, and you want to take a deep breath in and out. And at this time, I cannot palpate the liver. I cannot feel the border, which would be right here under the chest cavity. On the right side, or on the left side, you can do the same with the spleen. And I do not feel the spleen, so there's no enlargement of the spleen. And then you can begin to percuss. Okay, I hear tympany throughout. There is some slight dullness where the liver is. So we can, with our tape, again, percuss to where we feel the dullness. And then coming from the umbilicus up, we can percuss to dullness, and then we can measure that. And it is about 9 centimeters. And that is a liver measurement. Okay. Excuse me. On to the spleen, you could have your patient turn to the side slightly, and you want to go from about the 6th intercostal space to about the 10th and percuss, and you could hear some dullness, which would be the spleen. Okay, and then we can move on to the lower extremity. Okay. So for the lower extremity, you want to feel the skin first. There are no lesions. The skin is warm. It is light pink, dry, intact. There's hair evenly distributed, even to the distal toe, which means there would be good circulation. I see no swelling, and it looks like there is a nice venous pattern. Next, we will want to check for pulses. So I'm going to feel the popliteal pulse behind the knee, and that is a +2. I'm going to feel the post-tibial pulse, and that is a +2. And then I'm going to feel the dorsal pedis pulse. and that is a +2. Next, we're going to check range of motion of the lower extremity. So I'm going to have you raise your leg up and down. That is flexion and extension. And then out and in. That's abduction and adduction. And then bend your leg in, and then bend your leg out. And that's rotation, external rotation and internal rotation. And then I'm going to have you push up on my hand, okay, and then down on my hand, and then push in to my hand, and then out on my hand. Okay, so you have full range of motion and +5 strength of your hip. Then we would move on to the knee. I'm going to gently palpate the knee. Any tenderness or swelling? Do you have any tenderness?
No.
Okay. All right. Have you press up with your knee and down with your knee? Okay, so there's good strength. And then we can move on to the lower part of the extremity, to the Achilles tendon. And palpating, is that tender?
No.
No. And then the toes and the feet. Toes are warm, feet are warm and dry. There's no skin breakdown, no redness. We already checked the dorsal pedis pulse. So, the feet. I'm going to point the foot up and then back and then in and out. All right, and then push up with your foot and down with your foot and then in with your foot and out with your foot. Okay, so we have full range of motion of the ankle and +5 strength. Next, we're going to check coordination. So with this foot, I want you to bring your heel to your knee on your opposite leg and bring it down to your heel. Okay, and the patient was able to do that, so he has good coordination. So back in the sitting position, we can test the upper extremity. First, we are going to inspect the fingers, the hands, and the wrist. I'm looking at the nails, the hands, they're warm and dry, the skin is intact, nail beds are nice and clear and pink. I'm going to test capillary refill, which is brisk. We're going to test the nail angle, so can you hold your thumbnails together? It's a diamond and it's 160 degrees. We're then going to test the range of motion of the hands. So make a fist and then out, and then fingers spread, fingers in, and then turn over, and thumbs out. Okay, so that was full range of motion. We're going to test strength. So squeeze 2 fingers, and I would again do that bilaterally. You are going to make an OK sign with your finger and your thumb, and don't let me pull it apart. Okay. And then we are going to have your fingers push up and down. Okay, so we had full range of motion of the hands and wrists and +5 strength. We are also going to test for carpal tunnel. The first test is the Tinel sign. With the hand out, I'm going to tap on the wrist and tell me if you have any numbness or tingling.
No.
Okay, so that was a negative Tinel sign. The next test is the Phelan test. So you would have your hands positioned like this with your hands in flexion and hold that for 60 seconds. If in that time you experience any numbness or tingling, that could be a positive sign. If you have no numbness and tingling, that is a negative sign. Okay, you can stop. Okay. Next, we're going to move up to the elbows. I am going to palpate the elbow for any nodules or bogginess. There's no swelling. Do you have any tenderness?
No.
Okay. Next, we are going to do range of motion. So we're going to flex and extend, and then superpronate, hyperpronate, and then push up with your elbow, down with your elbow. Okay, so we had full range of motion of the elbow and +5 strength. Then we can move to the shoulder. So can I have you stand, please? Okay. And we already did this test before, but shoulders up. Okay, and then down. And then you can have your patient do arms up and down and back and forward. And what was the other thing we did? Oh, and then out and then in across the body. Okay, so you had full range of motion in your shoulder and +5 strength. The other test you can do at this point would be the Romberg test. So close your eyes and just have the patient stand for a moment. I can observe minimal sway, which is a normal finding. The next test would be for Palmar drift. So I'm going to have you put your palms out and arms out and close your eyes. Okay, and then do a deep knee bend. Okay, and there was no Palmar drift. Okay, so you can sit back down. The next test we can do is coordination. So I call them spider fingers. This is a rapid movement test. So spider fingers, and then knee taps. Finger nose. Close your eyes, finger nose. Okay, and he was able to do that in rapid, smooth motion, so he has good coordination. Next, we're going to do reflexes. So I'm going to take my reflex hammer, and first we're going to do the inner arm tendon. So I'm going to have inner arm, and I'm going to use the pointy side, and I'm going to tap the elbow. Nope, and there was a jerk there, so there was a reflex. Next, we're going to have the arm hang at a slight bend and use the flat side of the hammer, and there was a reflex there. Next, we can do the hold your hands. Hold your hands together. All right, and we're going to test the knee. So using the pointy part, you can test the knee and see if the foot does a reflex. And there was a slight reflex there. Next, you would go to the foot and do a dorsiflex of the foot, and behind the heel, do a tap for a reflex. And a Babinski would be, you could take the smooth part of your reflex hammer, and if this is the foot, you would want to start from the bottom and curl up under the toes. In an adult, you want a negative Babinski sign, which would mean that you would curl the toes. Babies would flare their toes, which would be a positive Babinski sign. And then you would want to test the ankle for clonus. So you would hold the foot and dorsiflex and then have it lower down. And if you saw any... To test for ankle clonus, you would hold the foot up and gently let it drop down to see if there was any clonus as the foot fell. Next, you would check sensation. So I'm going to use an unfolded paper clip for sharp and dull sensation. I'm going to test it on the hands, face, and feet to see if sensation is intact. So you would have the patient tell you if it was a sharp or a dull sensation that they were feeling. Okay.
Sharp. Dull. Sharp.
Okay. On the hand.
Sharp. Dull. Sharp.
Okay. And then on the foot.
Sharp. Sharp. Dull.
Good. Okay, so sensation is intact. To test for vibration, using your 128 tuning fork, you would have the patient close their eyes. I'm going to activate the tuning fork and place it on a joint in the hand and the feet. So tell me if you feel the vibration or you do not feel the vibration. Hold your hand out first. Good.
Vibration. Vibration. No vibration.
Okay. And then I would repeat the same process with the foot. Next would be position. So have the patient close their eyes, and I'm going to do a position on the finger and the toe, and you tell me what position your finger is in.
Up. Down. Down.
Okay, and I will repeat the same process with the foot. And position was intact. Next, you would do graphesthesia. I'm going to draw a number in the patient's hand, and you tell me what number I draw.
4.
Okay, and it was a 4, so graphesthesia is intact. Next, we're going to do stereogenesis, and I have an object here, and you tell me what the object is. I'm just going to place it in their hand, and their eyes are closed.
Bottle cap.
And it is a bottle cap. All right. The last test would be 2-point discrimination. So I'm going to use my paper clip again, and I'm going to start on the hand, and I want to get the points as close as I can together and then move them slowly out. But I want the patient to tell me when they feel like there are 2 points. Okay, ready?
2 points.
Okay, so it was that far away. And then I would measure that, and it's about 1/2 inch. Okay, and then I would do the same with the shoulder. All right, so tell me when you feel like there are 2 points.
Two points.
Okay. And that was about 3/4 inch. So that is a normal finding. And that would conclude my physical exam. Again, I would do everything that we did here bilaterally, and if I noted any abnormalities or any nodules or lesions, I would measure those and go through a more in-depth identifying process. Thank you. And I got 130/70. Okay. All right. After blood pressure, we would go on to skin. All right. So first, I would just inspect the skin. It is warm to the touch. It is a light pink color. It's soft. Hair is evenly distributed throughout.